speaking today to
Dean Lloyd, author, facilitator, radio show host, philosopher, and a student of life. And I'm here to offer you the kinds of information that you've been waiting for, the kind of information that's under the scope of confusion. I'm here to offer you resolutions and solutions.
and tell us a little bit about your education.
Oh, okay. I've been University of Wisconsin, Institute of Postural Restructuring, Pacific College of Oriental Medicine, Midwest Center for the Study of Oriental Medicine. By my process of using these tools, by my awareness. In other words, I don't have the tools controlling me, I control the tools. O3, it's essentially a triatomic molecule, and it's used as a steroid. And when it's excited, there's an O2, this is the oxygen concentrator, these are the tanks, but as an O2, it's charged through a crystal process where the electromagnetic frequency, or you would think of it as a ultraviolet light, that charges the oxygen, goes into the machine and it mixes it with water, and it comes out very different than a regular water molecule. It turns into a hydroxyl radical, which is OH, and that's for just a brief moment. But the purpose, of course, is that you're getting this detoxification while your pores in the skin are opened. And when you are essentially getting oxygen, it's going in through your pores, you're not doing it invasively. So people get a kind of aerobic workout when they're in there. In other words, they're getting their oxygen levels stimulated, right? And the singulate of oxygen that goes into the bloodstream.
And who comes and sees you for?
Mostly people that are in chronic pain, insomnia, metabolic dysfunctions, all kinds of anxiety disorders. I mean, the list is pretty extensive. Toxins. You can't get better if you're not, and here's a big one, people don't think of this so much, if you don't sweat. Cancer, and this is something Dr. Nkeo, anthropomorphic medicine, he's a doctor here in Preston, but he had pointed out in one of the radio shows that I interviewed him on, is that 90% of the people that get cancer don't sweat. Now, why is that? It's ridiculously high number, and the reason is that mechanism has been shut off. So instead of eliminating effectively toxins, you're harboring them. And where do they go? In the tissues, right? So you turn off signals that allow the immune system to regulate. And we have a lot of ways of opening them up in terms of turning on switches, right? There's proof back in the 90s, earlier than that, Canadian researchers, they found that it releases one of the immune regulators of interleukin-2, some form of detoxification. I personally just came off of a fast that was every fall, and every spring, every equinox, I do a fast. And this was a 5-day one. Your immune system's the weakest, going from cold to warm, and then into the hot season, and then from going from warm to cool, and then into the cold season. And that I just remember every time I do it, I'm so happy I did it. It's very powerful. Just to show you a latex glove, this is just some gas that's coming out of the tube. Just look, watch what happens to the latex glove once it hits that. It disintegrates. And that's just the ozone making contact.
Can I?
Sure.
I just want to see what it feels like. Just.
Yeah, put it anywhere on the latex.
Yeah, it doesn't hurt.
No, there won't be any pain. Regularly, this country is under the umbrella of what we would refer to as fear-based medicine. And because of that, there's all of this, prove to us that this works, prove to us, show us. This has been done in places like Cuba and Russia and India and Germany, especially Germany. for centuries.
From one time, 10 times, how does it?
Okay, individualized medicine means that you understand the pre-existing conditions. If someone came with an asthma, you have to deal with the asthma first, right? You don't want to put someone in a stressful situation unnecessarily, right? And the medications are there to ameliorate symptoms. They're not, and you can use them intelligently, but so much of medication use is not done intelligently.
How's it done?
Well, in a general sense, it forces the body into a place that it normally wouldn't act, right? It blocks the message, okay? And you're probably familiar with people, when they're using medications, they become basically prescription addicted. And this is something that we as holistic practitioners in naturopathy, oriental medicine, we're looking at other variables that aren't considered in typical orthodox medicine. It, in a general sense, reduces your stress level. Now, what does that mean? Okay, when you have oxygen available, that means that you are able to use energy potentials. You create by one way of getting energy is by eating, right? And if you're eating, you have to break the food down so it's assimilated, right? The nutrients, macro and micronutrients, are taken up into the bloodstream and utilized. If you're doing this type of therapy, you're increasing your ability to use those nutrients because the oxygen is required for that to take place. Nothing takes place without it. 3 minutes and you're dead without oxygen, right? So what I'm doing is I'm turning on switches in a very simplistic way. You're turning on switches that allow you to have access to using what your body needs in terms of it being available, bioavailable, and eliminating. Because everything that comes out of our body has to be combined with a singulate of oxygen. Carbon dioxide, everything has got to be eliminated with that process. Because here's the symptom, and here's standard of care, and this is the way you're treated. I look at you as an individual.
So what I'm understanding you say is that each individual person that comes in may need a host of things kind of done with them.
Typically, yes.
And this is
just one of the pieces. One of the pieces. Yeah,
and so it's not like come in, do this 5 times, you're good.
Well, no, there are protocols, and they're made for a reason. However, there are no panaceas. And very often people will come to me with so many holes in the program that I have to decide whether I want to detoxify them or build them up first. So it's a process of not looking at a herd mentality.
Costs involved? Take me through the process.
I have a website that people can access, acutone.com, acutone.com. They can email me. My phone number's on there. You can contact, but keep in mind that a lot of people don't live in my proximity.
Correct.
So
Yes.
I do, most of my patients are done over the phone or on Skype. So I have people that are in Europe, that are in, one coast to the other. It's available, and I have my intake fees and what I offer in that way. But I'm primarily here as one to be as an educator and facilitator for their process. And someone has to control the ship for a while until you get the ability to do it for yourself, right? Okay, and again, my job is to empower you. And that's very different from what you and I were brought up with. We're taught to give our power away, and to somebody who's more educated than we are, and we should demand, and I mean this for real here, we should demand that we be the ones informed on what is going on with us. We want to understand how these tests will be useful to us. We want to understand what's appropriate for how we manage our energy. So much of this is just tossed to the wind. People aren't given the tools to know how to manage their, the tools they're given are insufficient. Okay, so I'm here for you. I'm not here for people that want to enter into something. You can dabble, but the people that really are looking for something new and is going to be changing the way humanity is functioning on a fundamental level. We're talking thousands of years of programming and how people have been processing information. We have answers that will break open all the psychological models, the models of how health has been perceived, and these pieces that some good people are doing, we can tie them together.